Hello, how are you? Tiffany Robinson here from Beyond RCM Revenue Cycle Management here in the state of New York. And I am going to jump right into this RCM Roundup. So I'm sure if you are in the healthcare space, everyone is aware of what took place on December 4th in my home state of New York, where CEO Brian Thompson was murdered in New York City. In putting together this RCM Roundup, it was very important to me to be respectful of a horrible tragedy that has taken place, which is the loss of life for an executive in the healthcare industry. But I also wanted to take this opportunity to really have some meaningful discussions about concerns within the healthcare industry that have been coming from patients, most importantly, and medical providers for years. So this is going to be a very interesting roundup because I have the task of being sensitive to the loss of life, and that is the loss of life for Mr. Brian Thompson, who outside of his career was a father, was a husband, and was well respected in his community. So I have the task of balancing being respectful to Mr. Thompson while also discussing an issue that, quite frankly, has been a problem in the healthcare industry for quite some time. And I think that it's really time that we start having some meaningful discussions around access to care, around patients being able to get vital treatments that they need and deserve. So I have a very delicate dance to do on this roundup, and I hope that I do a good job of doing so. So Mr. Thompson was killed on December 4th in New York City. And I'm not going to, at present date, police have caught the alleged murderer. I'm not going to say their name on this YouTube channel because they're getting enough publicity from all of the other media outlets. They don't need me giving them any additional shine. But the killer has been caught in the state of Pennsylvania. And as of this recording, law enforcement is working to extradite this suspect to New York to face charges. When it comes to the suspect, initially when everything first broke, myself and many others started thinking maybe he had services that were denied by the insurance company and had a grudge with the insurance company. Maybe he knew someone, etc. UnitedHealthcare has put out reports saying that this individual has never been covered under their network. So they were not a member of UnitedHealthcare. The suspect apparently was a healthy young adult, came from a family of means. He graduated valedictorian of his high school. For our watchers outside of the States, it means that he graduated at the top of his class in terms of grades. And he also went to an Ivy League college. So what reports are suggesting is he had very strong opinions about the healthcare industry, and those opinions were not favorable. But obviously, we're going to have to follow this story to learn more about what motivated this young man to commit such a horrible crime. Some of the posts that police and law enforcement have read from the suspect give way to him complaining about corporate greed from insurance companies, etc. So again, we're going to have to watch and see how this plays out. But long story short, Mr. Thompson is deceased. This young adult's life is forever going to be changed. And there are a lot of mixed emotions. I'm reading a lot of feedback from different areas, different outlets. And for example, obviously on spaces like LinkedIn, where I have connections with many individuals who worked with Mr. Thompson through social networking, I'm connected to them. Obviously, they're devastated. Many of them have nothing but great things to say about him and working with him. And then obviously there are other arenas where I am reading comments where people feel like this individual who committed this crime was like some type of like vigilante rendering justice to an insurance healthcare system that has made the lives of so many people difficult for years, right? And I just want to say, no matter what side of the coin you fall on, speaking for myself, all human life is valuable, right? There are many patients, and I'm going to talk about one in a second, whose lives were not valued by insurance companies, and they had to fight to get the care that they deserve. Those lives matter, and Mr. Thompson's life mattered. And I just think it's tragic on both ends of the spectrum. And as a human being, reading comments from individuals who are celebrating this crime, it breaks my heart, because I'm just like, okay, where is our humanity? And I know some people may comment and say, well, where is the insurance company's humanity? And I don't disagree with that school of thought to a certain extent. But although I can be very bewildered by some of the practices of insurance companies, it still doesn't make me devalue the life of Mr. Thompson. And two things can be true at the same time. This case is bringing a lot of publicity to the insurance industry and what many view as tactics that the insurance companies use to delay and deny treatment to patients in need. And in doing my research, I really started reading different articles from individuals who have had experiences with insurance companies where they needed life-saving treatment and didn't get that treatment. And I think that, like I said before, this is an opportunity for us to really start having some meaningful discussions about a broken healthcare system. In the United States of America, we pay the most amount of money towards healthcare, health insurance, health-related costs. So we spend the most compared to other developed nations in the world. However, we do not have the best health outcomes. We have some of the worst healthcare outcomes. We have a shorter life expectancy than other parts of the world. We have higher, infant and mortality deaths in the United States. Women, African-American women that look like me, have some of the worst outcomes when it comes to prenatal and postpartum care. So it's very evident that our healthcare system is fundamentally broken, and now we're in this vigilante phase where people are feeling that to go out and take the lives of executives is the way to exact justice, which that doesn't fix a broken healthcare system. So in doing research and just, reading up on different experiences, and I'm going to share an experience that I experienced this year with two family members. I want to bring light to an individual by the name of Dan Hurley. And this article that I read, it's called Delay and Deny: The Outrage Over Prior Auth, right? And this is an article that was published by New York Magazine by journalist Chris Stanton. And in this article, Mr. Stanton talks to different individuals who have literally had to fight with insurance companies to get life-saving treatment that they needed, right? So the writer talks, one of the families featured was the family, or the person rather, of Mr. Dan Hurley. And Mr. Dan Hurley got into a huge battle with Blue Cross and Blue Shield because he developed a form of cancer that required very aggressive treatments. And what should have been a patient being able to get access to care to not only manage his cancer, but also the side effects of the treatments from cancer, turned into a huge back and forth fight with his insurance company, where Blue Cross and Blue Shield was literally, denying authorizations for medically necessary services. And Dan, who was someone of means and worked as a physician, actually had to pay out of pocket for a lot of his expenses because Blue Cross and Blue Shield would deny the services. He would then have to spend time going back and forth fighting with them. And because he didn't want to delay his treatment, he paid out of pocket, and then with the hopes of being able to be reimbursed by the insurance company after the fact. Now, obviously, that's not a viable solution for many people. Many people who are facing health crises don't have the money to say, I'm going to pay for this service out of pocket until I sort this mess out with my insurance company. I want to also point out that Mr. Hurley, I did some additional research after reading this story. Mr. Hurley passed away as of the summer of 2023. But one of the biggest things that was important for him while he was battling this illness is he actually went back to school, to law school, to learn how to better defend people such as himself against situations like this with insurance companies. I, in previous videos, talked about losing a loved one several months ago at the beginning of the summer. And what I will say is, although we didn't have this type of issue to contend with the insurance companies, I do understand what it's like to watch a person battle a disease such as cancer. And when you are battling a condition like this, the last thing that patients need is to be fighting with their insurance companies over prior authorizations, fighting with their insurance companies to try to justify medical necessity. When you're faced with a diagnosis of cancer, especially if it's an aggressive form of cancer, time becomes your most valuable asset. In general, if anyone knows me, you will often hear me say that my most valuable asset is time, and I have no time to waste. But outside of that, when someone is facing a debilitating condition and time is of the essence, they should not be spending their time fighting with insurance companies to get services approved. They should be able to get the treatment that they need and be able to spend every possible moment with their family and loved ones without that additional burden. And the insurance industry has got to do a better job of helping sick populations, especially when they are battling aggressive forms of diseases. Now, prior authorization is a mechanism that was originally intended to save patients money. That's the way that it was hyped up by the insurance industry, and to reduce waste, right? But what we have seen in recent years through countless of patient experiences, is that's not what it's being used for. It's being used to delay treatment. It's being used to deny valuable treatment to patients. And we have lost the compassion component in the healthcare industry. Now, when you look at an industry, for example, like UnitedHealthcare, let's take a company like UnitedHealthcare. UnitedHealthcare, which is where Mr. Thompson works, is the largest insurance payer in the United States of America. I'll give you an example. Earlier this year in the first quarter, we had to contend with the Change Healthcare cyber attack. I posted a couple videos on that and my experience as a RCM director. Okay. So while medical providers were scrambling to figure out how they were going to get paid, UnitedHealthcare had reported their profits in the first quarter of this year, and they reported that they made over $5 billion in additional net income. And it's important to note that Change Healthcare is owned by UnitedHealth Group. So when you have a company that is boasting about, and I'm sure that they didn't know when they put out those earnings that the Change Healthcare cyber attack was going to happen, because obviously they would have held off on putting that out there from a PR perspective. But it all came out in the wash, right? When you have a company that is boasting about its earnings while medical providers are scrambling to keep their practices open, while patients are having to fight to get care that they know is medically necessary, but some person on the other line or some algorithm is saying that it's not medically necessary, we have a problem. We have a problem, and we have to do a better job. I will tell you, as someone who works in revenue cycle management, I cannot tell you how many times we've had services denied as not medically necessary for our patients. We've had to go as far as requesting a peer-to-peer review. So a peer-to-peer review is pretty much a step that you have to take when you're going through the authorization process. If once you submit your clinicals and information, the insurance company determines that the services are not medically necessary, one of the tools in your toolkit as a practice is you can request a peer-to-peer review. A peer-to-peer review is basically your physician talking to a physician from the insurance company, explaining to them why the services are medically necessary. Do you know that many times when a provider of a certain specialty engages with a provider from the insurance company, that provider that they're speaking to about their patient is not even the same specialty? So let me give you an example. You can be an oncologist treating a patient for cancer, try to get a service authorized, end up in a peer-to-peer review, and then you're on the other line talking to a pediatrician, a physician that specializes in dealing with children. And that pediatrician is then telling you that the services you as an oncologist is trying to get approved for your patient is not medically necessary. I mean, what could be more insane than that, right? A physician who is not well-versed in your area of study and expertise telling you, the specialist, that your services are not medically necessary. We have a problem in the insurance industry. And it is not going to go away until we really start taking meaningful steps towards fixing the problem. I'll give you another personal example. I have a loved one close to me that has battled chronic back pain for many years. We've tried multiple treatment options, and, each option brought temporary relief, but never long-term relief. So we finally got information about a promising method for a back procedure. And it's pretty much like the last step that you take before having to do back surgery. And no one jumps up and says, hey, I can't wait to do back surgery. Like, back surgery is like a last resort. So obviously, we wanted to explore this option before defaulting to back surgery. What ensued was a year-long fight with the insurance company to get this treatment approved. The same insurance company that has a well-documented history of this individual and their chronic back pain and the treatment methods that they've tried and failed. This insurance company decided to get in the way of a treatment that could prevent back surgery. And luckily, because I am someone who worked in the healthcare industry for over 2 decades, I was able to maneuver through different departments. I was able to engage with the member services department. I was able to engage with the prior authorization department. And we were eventually able to get that procedure approved for that family member. But guess what? Not everyone has a family member who works in the healthcare industry with over 2 decades of experience. And when you come against an insurance company that is defiant about approving services, oftentimes, what do you think happens? The patients give up. They're like, forget it. And health conditions become worse and health outcomes become worse. So as I close this video, 2 things can be true at the same time. We can be devastated that someone decided to take the life of another human being because they fundamentally disagreed with certain practices in the healthcare system. That can be true. But what can also be true is our healthcare system has a serious problem that they have been running from forever because they've been hyper-focused on their profits. And that is putting patient care first. If we say we're in the business to help patients and to remove barriers to care, then insurance companies need to start acting like it. Because Dan Hurley is one of many stories of individuals who were faced with unfortunate odds, and their insurance company did not make their access to care easier. It did not save them money. It made their journey even more difficult. So I really hope that in the coming months and years ahead of us, that the insurance industry does a better job of helping patients who truly need access to care get that access to care.